Boom. 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 We're live, everybody. Hey, welcome. Red TV and Conversation. I'm Peter Clark. Super pumped to have you here today. And hey, if this is your first time watching, I really appreciate it. If you are coming back for a second or third time, you already know what you're in for, so I appreciate that as well. Hey, we're live today. We're going to be talking about something that's so important to me. And before we get to that, hey, I just want to throw up a couple things here. If you like what you see, please like and share with your network. Really important. We always want to make sure we're bringing you value, and I hope that resonates with you at all. Hey, I also want to welcome anyone over in the Europe region through the Facebook page of 𝘄𝗶𝘁𝗵. A lot of people out of England and Ireland and Scotland and all kinds of cool places. So hope you guys are enjoying the show today. We are live on Facebook and Twitter, and we're also Twitch, YouTube. We are live on LinkedIn, wherever.com, wherever the kids are today.com. That's what we're doing today. Listen, everybody, this is a super important show. We're going to have some fun, of course. We're always going to try to have some fun, but we're also going to be bringing some information that I think is really important. It's certainly near and dear to me. Just to preface it really quickly here, the intention today, today's goal, the whole purpose of today really is to educate and inspire people into action. That's what we're trying to do today. Okay. So again, it's not meant to be heavy or anything. We're kind of move through the information very quickly. We're going to touch the surface. This is such a very as you can imagine, a very big subject matter. And so there's no simple answers to anything that we're going to be talking about. We're going to be talking about things about the heart. And because we're talking about medical issues and things like that, we're not trying to give medical advice here, okay, today. So it's really important that no matter what happens or what you read and research, always recommend you do a ton of research, but make sure you consult with your doctor, people on your medical team, whoever you have in your life. Go to a human being who is qualified to answer your questions and so on. So today, to take the pressure off my wonderful guest today, please make sure this is not advice we're giving right now. We're using professional education and just questions and conversation to make sure that you're getting some answers to things that are really important to all of us. I think we underestimate the power of all things to do with the heart. Heart matters, and that's a really fun play with words, because again, I think we just take it for granted. I know that I did. Always felt very healthy, always felt very good, and I had an incident in December which just basically changed my life, and I had a team of people to help me feel good again. And this lovely person over here is one of those people. And I said, listen, I got to talk to you about this. I got to tell people about what we've done together. And so I wanted to make sure I had an opportunity to bring this lovely person on. Before we start here, I just want to look at all these beautiful comments here. Hey, looking forward to the conversation. I'm just going to throw it. Please, if you got questions and stuff, we're going to try to get to those. We're going to do. Daniel, good to see you, brother. Always good to see you. Boom. There we go. Marilyn's in the house. That's right. Hey, Bill, always good to see you, my friend. Appreciate that. LinkedIn user, I'm going to guess, I'm hoping that could be Suzanne. That could be my beautiful wife, Renuka. That could be any of those people. That's for sure. Hey, Melody. Hey, Melody, I read your article about your heart situation. I'm going to talk about that today, and hopefully maybe my guest can add something to it. And here we are listening from the UK right now. Boom. Love it. Glad to see you here from the UK. It's super to see you. Let me introduce my guest. Let's get on with it real quick, because we have so much to cover. Please don't take it like I'm trying to rush through. I'm not. It's just trying to be respectful of your time, and certainly this guest, because this guest is giving us time, and she is very busy. Let's talk about it real quick. An acute care nurse practitioner. Always wanted to know what nurse practitioners do. You're going to find out. She's an acute care nurse practitioner at the Foothills Medical Center in Calgary, Alberta. She holds a master's degree in nursing, specialty with a focus of cardiology from Dalhousie University in Halifax, which I didn't know. I'll tell her a little piece about that in a second. The connection as a maritimer right here. Boom. Also holds a bachelor's degree of nursing from the University of Calgary. She's a wife. She's a mom of 2 young boys. Like, she has nothing on the go, as you can see. And she keeps her heart healthy by running half marathons. How cool was that? Most importantly to me personally, she was one of the team members that helped save my life. And so that is near and dear to me, and so on. And I'm not going to get emotional today. I'm going to do my best not to be emotional today. I'm going to stay pumped. I'm going to stay excited. Please, everybody, welcome Leslie Poirier. How are you? Oh, you got to mute.
I'm unmuted. I'm good. How are you?
How are you? Good to see you.
Good to see you too, Peter.
Gosh, I'm so grateful for your time. I know how valuable it is. I know you got things to do. She's not on the clock yet, everybody, but if her pager goes off and she got to go, she's already warned me of that. So I appreciate that. And we've never had a conversation before. I want to let everyone know that. I mean, we've met through masks, and I know you saw me at my worst. So I appreciate the fact that we have a chance to do this. And you know what, strangely enough, Leslie, is that when we were in the hospital together, well, not together, but you were there too.
Yeah.
I never did ask you to pull the mask down and say, I want to see you. And so this is really the first time I'm really kind of seeing you. So it's kind of cool. So it's great to meet you.
Yeah, I think it's really hard right now with the masks and the eye protection for patients, hearing you, connecting with their healthcare providers.
Right. It's so important. I think that's what, again, this human connection that we have is getting lost in that. And, you know, that's a subject in itself.
That is, yeah.
So first of all, I want to say thank you very much for everything that you do, and people in the medical community, all your friends and colleagues and all the people that do what you do. I was there. I know exactly what you do. I have a really strong sense of it. It is just unbelievable what you do, and I'm so grateful. And I just want to say thank you. That's my first thing right there.
You're welcome.
Absolutely.
It's our pleasure, I think.
Well,
as a team.
It's a gift. It's a gift for you to be in the medical community and want to dedicate your life like that. I always got to start by asking, you're a family person, 2 young boys and so on. Want to make sure everyone's healthy. You good? Everyone healthy in your family? Everything good?
Yeah, everyone's good. We're all getting through this pandemic.
Yes, exactly. It must have been, it's a challenging conversation for anyone during the pandemic. But what we're going to focus on today is something that is I certainly wouldn't use the word pandemic, but my gosh, if you use the numbers alone in the world, you could probably go for using those terminology. So before we set the stage here for the conversation, talking all things about the heart and literally what happened to me a little bit, and the goal today is to give some advice from your perspective. So to set the stage for that, can you just share with the audience a little bit of your expertise, if you will, in the world of cardiology and all things heart, just so that people understand, basically what you do?
Well, I'm a nurse practitioner. Nurse practitioners are registered nurses who then go to school and get a master's degree, as well as some specialized training into being a nurse practitioner as well. So you kind of graduate with 2 certificates, a master's and then your NP. I've always worked in cardiology. Ever since I began bedside nursing, I worked in cardiac surgery and cardiac intensive care at the Foothills, and then went on to do my master's degree in my nurse practitioner, and never kind of strayed. Did my cardiology specialty at Dalhousie in my NP program, and had just always really had a keen interest in cardiology. I also loved cardiac surgery as well. I worked there for 11 years as a nurse practitioner prior to taking on the role that I'm in right now.
Fantastic. Wow. And the connection I just wanted to mention to you about Dalhousie, birth certificate right here.
Oh, really?
Halifax.
I loved Halifax. It was the best choice I made to go there. I applied for 2 different programs in the East and got into Dalhousie and thought, why would I not go live in Halifax for 2 years?
Right. It's a super cool part of the
The
world.
people are wonderful.
Right. It's Eastern Canada, just for people across the globe. That's why I mentioned the UK, and I love Ireland. Gosh, I'd move to Ireland tomorrow. That's a heads up to anyone listening to the show. If you got anything for me to do, I'll come over. But the East Coast Canada is very similar to England, Ireland, Scotland, this kind of feel. So I know what you mean. It's a very it's a wonderful part of Canada and a wonderful part of the world. So throw that out there. Now listen, I know we again, just to set up this interview, we briefly talked. But I told you to hold all your stories because I want to hear them myself at the same time as the audience. So I know that your passion for cardiology and it runs very deep, and it has affected your family, and you grew up with a significant incident in your life. So please tell us basically how cardiology and the heart disease and things like that have affected you. Tell us that story of why you're so passionate about what you do.
My dad died when I was in my 20s of heart disease, which we did not have any kind of inclination that he had any heart problems. He, in fact, 3 months before he passed away, him and I were racing on the treadmills at the gym. So he was 58, but that's still very, very young. He does have a brother who has heart disease, and subsequently his other brother has been diagnosed with heart disease as well. So we do know genetics play a really strong part in heart disease. My dad was 58, out hunting with his friends, so kind of out in the middle of nowhere. And he had a cardiac arrest, and his friends worked on him for an hour until the ambulance came. But by that point, he was gone. Then my mom found it. Well, the friends of his went to my mom and told her, and she was so shocked that he could have anything wrong with his heart. She actually went ahead and asked for an autopsy to make sure that it was definitively his heart. Retrospectively, that's a good thing for my brother and sister and I to know as well, right? Because genetics, we know, plays such a big role, and especially in early heart disease, when people feel like they've done everything right. You know, genetics, you can sometimes stave it off, but if you're genetically prone to heart disease, it's something that you need to be really aware of.
Yeah, wow, that's a shocking. And 58, by the way, is very young. By the way,
Very young. Yeah.
You know, again, maybe 100 years ago it wasn't, but today,
No, it is.
that's a young person's body.
Yeah.
And I think you hit on something. We're going to talk about this because this is why we're talking. Is that very similar in the sense of what the setup was there, which is no signs, nothing, like no diabetes, no high blood pressure, all these factors, and you're just rocking and rolling and doing your thing, and the next thing you know, just what happened, what you talked about with your dad.
Yeah.
Speaking of that, I really appreciate you sharing that. Like I said, I wanted to do this. I said this will be so cool to do this, and God love your mom for wanting to do this. I'm going to call your mom right now. I'm going to call her and see if she'll pick up the phone. Just to say hello to you, because she is super proud of you. I know that. I just talked to her like a few minutes ago to see if she would jump on the line and to see if she's there. God love her. Where is she? Hope she's there.
Hello.
Doreen, how are you? This is Peter Clark. How are you?
I'm fine. You.
I'm good. I think I can hear you. Can you hear me okay?
I can hear you. Thank you.
Oh, you're coming in and out. Okay, so keep going. Hey, listen, super cool to meet you. I don't know you, but your beautiful daughter is part of a team that helped save my life. I think you know that, right?
I'm very proud of her.
Oh gosh, yeah. Hey, and I just wanted to say thank you so much for just being part of this, where we can share the story and make the connection point that it runs very deep. It's not we're just talking about it from a medical professional perspective. We're talking about from a human perspective and a family perspective. I'm just curious from what Leslie just told me about your story, is that when that happened to you, if you don't mind me asking, is that you did go for the autopsy, and so it was so shocking to you. It was so shocking to the point that, I mean, it was never even in conversation or on the radar. Is that basically what the situation was?
No, but I would say because of the genetic connection with his brother, he had been investigated for heart disease. He had stress tests, which is running on a treadmill and so on, and it was all normal. So a family doctor was shocked as well that he actually had a major cardiac event.
Yeah, so, everything you just said there is me. And so this is why this is so shocking. It's so shocking to hear that it's somewhat common as well, that it's not unheard of to what you just said, that there was no signs and nothing. So when you got that news and you had that done, and then you found out that was it, did it put any ease to the situation? Did it make a difference of how moving forward with knowing what that experience was all about?
I think that when you have an autopsy done and they tell you that he did have some cardiac disease, which we weren't aware of, it makes me very aware that life is precious. And we do not know, just as you said, sometimes it's called the silent killer for a reason, because people don't know that they're walking around like a time bomb.
Yeah, see, and I know from me now that I've kind of been through a similar experience, is that it's not about fear factoring. It's not about any of that. It's about awareness. It's about having these open conversations to make sure that we're at least talking about the signs and symptoms and anything that's on the radar, that we can even go down that path. What I thought was interesting as well, that you mentioned that, that you recognize that there was some sort of family history there. So in that part of the family, you were aware of that. And so that was triggered you the idea that it was probably that, correct?
Yes, that
Yeah.
was true. His brother had major heart surgery because of heart disease and had 5 bypasses done. So we knew it was in the family, on his side of the family.
Right.
Sure.
Right. So let me ask you this question, if you may. And listen, I so appreciate you coming on. It's so nice to meet you, by the way. But can you, if you were to give a piece of advice about the experience that you've had, you can obviously look at things leading up to that event. You can look at things years after it. Is there some piece of advice from family members who may be concerned about people in their lives about this subject matter? Do you have any advice that we can share with them about your experience? I'm losing. I've lost your signal a little bit. Sorry, I've lost your signal.
You're cutting in and out as well.
Okay, sorry. That's the internet. Thank you, internet. It's all live. Go ahead. Go ahead. I got you now. I got you.
Okay. So I'm just saying that people should be aware that heart disease is serious, and we need to take care of our bodies. We need to eat well, exercise, and look after things. And even then, like with Leslie's dad, the doctor was shocked. He said, I don't know what else I should have done. Right. Because there was no indication, right? And so that's kind of an issue in our medical profession too, is how do you get people to know that there's something wrong if they have no symptoms?
Right.
I struggle with that all the time.
Yeah.
Like, why did we not see something? Right?
Yeah. So. Listen, I so appreciate. Yes, I totally relate to that, and that's part of my psychological journey right now for me, is that I did not see it coming. So I'm relating to everything you just said. Is literally, you read my mind, and but the message is most important to everybody. Just know that it's possible. That it's in your family. It could be physically in you, and just to be aware of the signs and all of the markings that potentially would push you down to investigating further. Doreen, it's been a pleasure to meet you. I think you should be super proud of Leslie. I am.
Thank you.
Okay, thanks, Mom.
That is so cool. Hey, how you feel with that? She's super proud of you.
Yeah, thank you.
Yeah,
she's my mom. She has to be.
Well, she kind of has to be. I know what you're saying about that. I know what you're saying about that. It's all good. So, no, I super appreciate her being open enough to have that conversation, and her message is just as powerful as I was expecting it to be. It's reminding everybody that it could be anybody, anywhere, and anything. So we're not trying to obviously scare anyone. This is all about the information and so on. I'm just going to jump into the comments and see who else is here right now. Always appreciate my friend Tim. Good to see you in Pennsylvania. Always good to see you, my friend. There's Tony. Boom. Tony McClellan. How are you? Good to see you in the UK. Love that lady. She is super awesome, cool. And here we go. Lo, thank you. Thank you for the job you do, Leslie. Thank you so much for helping Peter. So there you go. Hello from the Netherlands, Danielle. Sorry. Hey, listen, good to see you. Always good to see you. Another fan of the show, and been on the show, by the way, Leslie. This is a beautiful person as well. And Wendy, always good to see you. Looking forward to First Red TV live show. That's right, for 2022. Had a couple things on the plate. So yeah, this is it. Again, good heart health based information today. Thank you so much, Wendy. We appreciate that. So let's just jump right into it. We have so much to cover here. Again, I wanted to jump in that heart disease itself. It's such a common phrase and word. People just say heart disease. And I don't know if people think it's just one thing. If they think, oh, that's heart and stroke, or that's, that must be just your arteries and coronary, or just from your perspective of how to simplify this, what exactly is heart disease, so that people can kind of get a feel that it's not this giant subject matter, but it is a collective of things and not just one thing?
Well, heart disease can be a few things, but heart disease for the basic would be when we're talking about coronary artery disease or vascular system disease. We could also talk about stroke related to that, because vascular disease can encompass heart and stroke. Heart disease, when I'm talking about it with patients, for the most part, are patients following either an angina episode where we found blockages in their heart vessels, or heart attacks.
Bingo. So there you go. Well, you just described everything to do with me, by the way, and that's why it resonates with me when you say that, the concept of angina. So let's just cover that real quick for people. When you said that we're an angina, and I think people have heard this phrase before, well, what exactly are you referring to when you say angina? Just so that people kind of understand and recognize what that is.
Well, so classically, we would talk about chest pain, or as lots of people describe it, an elephant sitting on their chest or pressure on their chest. But we do know now, with lots of research about women and men, everyone has different experiences as what could be their angina symptoms. Women present with all sorts of different things, and not necessarily that heaviness in the chest or central chest pressure. That seems to be a bit more common with men. Women, we have all things like elbow pain or earlobe pain or a backache. That also could be encompassing their anginal symptoms. So just really to listen to your body. If something seems like it's repeatedly happening, and maybe it's exertional, so happening with exercise or walking up the stairs or activities of daily living that you used to be able to do,
Yes.
just kind of going in and getting checked out and asking the questions.
Yeah, great point. So I want to add to that. Through my experience, was exactly what you just said. This weird, strange pain, like right in my breastplate, if you will.
Mm-hmm.
It felt like it was on fire from the inside. That's what it felt like. Fire.
Yeah. For some people, it's a gastric kind of pain where they actually feel
Right.
like they have heartburn.
That's exactly why I wanted to mention that. I didn't think it was heartburn, but that's what it felt like. So if someone has experienced this heartburn, I'm going to guess that they might think, oh, it could be just that. And to your point, you know your body, so you know when it's not in sync. So I really did. It took me a while as a guy, but I did recognize, wow, this is not normal. This is not feeling right. Again, mine was related to an idea that I had an injury from playing hockey,
Right.
and so I just, typical guy. And I don't mean to say that derogatory to anybody. I just think I'm telling you, for any of the males out there and anyone who is connected to a loved one that happens to be a male, our brains are just not wired to go and seek help. We just don't. We just think we can walk it off, shake it off, and so on. And so this is where, and I did that, Leslie, for 3 weeks, by the way. I did that for 3 weeks.
I remember our conversations. Yeah. And you played hockey.
And I played hockey
some of it. Yeah.
3 days before I came to see you. Can you imagine that? I was just like, wow, what was I thinking? I was so close anyway.
But you didn't know.
I didn't know. I did not know. And so that's the whole point of this conversation and so on. I do want to talk about this idea of, let me just see if I can pull it up. I'm going to see if I can pull up this particular graphic here. I hope it will show up. If it doesn't show up, I'll talk about it in a second with you. Let me just see if I can get this graphic up to show you what we're talking about, everybody. I'm trying to share here a little bit about what, here we go. This is basically what happened to me. It's just so we can put it into context, so you just kind of know what I'm referring to when I keep talking about it. I had a video or two about this already, and I shared this a little bit, so I don't want to keep going with the concept. But there it is. There's a graphical picture of what my heart looked like. And basically the LAD, which is referred to as the widowmaker, unfortunately, had a 99% blockage and a 70% blockage, which to me is just overwhelming at the very least. Here's a question for you, Leslie. If you don't want to answer it, it's okay, because I put you on the spot. You know what I don't understand? I don't understand why that 99 is higher up than the 70. Wouldn't it make sense that the one that was started earlier happened, or am I assuming that it started earlier?
So a couple points. The left main is actually the widowmaker. So the top part there, the little short branch that you can see,
the little one
that
right
bifurcates into the LAD and the left circumflex, is the widowmaker. Because when that one blocks off, that you pretty much lose all of your blood supply to the left ventricle, which is the big pump that pumps blood to the whole body.
Got it.
So the LAD, though, it's not a good one to have a blockage in either. It's the major vessel that feeds the front of the heart for most people. Everyone has a little bit different coronary anatomy. So we never really know until we do an angiogram or a CT angiogram what we're going to find. So really, you can't assume that the 70% downstream was there before the 99%.
Okay.
Those both could have been the day before you had a heart attack. If we'd done an angiogram, 20%, and then you had a plaque rupture in the 99% one. So the walls had a buildup of what we can talk about as plaque or cholesterol or lipid deposits. And that 99% was your heart attack, and the plaque ruptured and caused that vessel to be blocked off, bringing you into the hospital with very bad chest pain and ongoing chest pain. As well as if it was later, you can come in with signs and symptoms of heart failure.
Right. Now, and these, again, all these terms is what I'm saying about trying to educate people and so on. Some people think that heart failure means your heart stops, literally stops beating and so on. So just clarify that for everybody, that heart failure is...
Heart failure is when the pump is not pumping as well as it should be. So the big left ventricle. And what can happen is people can get fluid backing up into their lungs because their heart's not doing the job that it normally does, and the heart's overloaded. So fluid backing up in the lungs, shortness of breath, swelling in your ankles, those sorts of things are what we see people coming in with. Not being able to lay flat in your bed, having to sleep upright in a chair, feeling that you can't catch your breath just walking 5 steps, those sorts of things. So we ask a lot of questions too when people come in, like, what could you do before? And how much were you limited by your symptoms?
Right. And finally on this, because I need to move along to make sure we get as many questions as we can in for you, is that 99, you talked about plaque rupture. Can you share that basically, from my understanding, and just, kind of clarify, is that basically if you have plaque on your arteries in your system, an event of some sort, maybe I'm going to guess maybe a physical event, could jar a little bit of like a flake of that, if you will, off, and then it goes through your system and can go kind of like the way a block of ice in a river can push up against a bridge kind of thing. Is that similar to what we're talking about here?
Somewhat. Yeah. It isn't always necessarily exertion. It could just be as we age, we all calcify a little bit, I guess is the best way to put it. And so if we were to do routine angiograms on people, which we don't do unless they're having symptoms of heart disease, you would find that there's probably lots of people walking around with blockages or narrowings of vessels because we deposit calcium in our body and that sort of thing, as well as have lipid, if people have higher cholesterol levels, can have narrowings in the arteries. Yeah. The plaque rupture is what causes the acute event of the heart attack when people come in. Now, there's different kinds of heart attacks. We could talk for 2 hours because really the kind that you had is a different kind of heart attack than some of my patients who come in with more of balanced heart disease. So they don't just have one vessel that's blocked. They have a few, 2, 3. So they come in also with having a troponin level rise, which is the enzyme that leaks out of the heart, and we can pick up on a blood test when the heart hasn't had enough oxygen and has some damage to the muscle. And so that's typically how we diagnose patients with heart attacks. ECGs are also very helpful in the kind of heart attack that you had, which is called a STEMI. But we have patients come in with non-STEMIs, so ST elevation myocardial infarction versus non-ST elevation myocardial infarction. And then there's a whole umbrella of acute coronary syndrome where patients come in with just angina, so chest pain that hasn't actually caused damage to the muscle yet, but is causing them enough symptoms that they come in and they get put in that group as well, where they would go for an angiogram and we would likely want to take a look at their coronary arteries.
Gosh, you covered so much. Thank you for there's so much in there. And again, everybody, this is all about just education, and we're just trying to get our heads around it. I'm going to tell you something. I got to put it on record here right now. I've not said those 2 words that you said. You keep saying that I had something.
I know.
I can't get it in my head. It is stuck. There's a blockage there. I can't psychologically and spiritually and emotionally and in my soul. When you say that I had a heart event that you're suggesting, now I can go back in time and remember very specific moments where I should have dialed 911. There's no doubt. And I can pinpoint 2 specifically, just so that you know. Yeah, one of them was on the ice playing hockey, by the way, and one was 3 o'clock in the morning. That literally woke me up. But anyway, I just wanted to share that with anybody because I have a funny feeling that that's not uncommon. That people struggling with the idea is like, you said I had what? Like what happened? Like I can't get it out of my head. I just can't
Well,
get
in hindsight, it's 2020. So that's another thing to think about too. Often people will say, oh, I didn't realize that all those other times that was a symptom. Especially because if you don't know there's anything wrong, why would you go down that path? You're young, you're healthy, you're doing all the right things.
right.
Yeah.
And this is exactly what happened to me is that, I mean, it was only 4 or 5 months before this that I had my annual physical. Everything came back and you basically
Yeah.
get thumbs up on everything. Don't have diabetes, don't smoke, not carrying a
Yeah.
whole bunch of weight.
Cholesterol was good.
Cholesterol was good, all
Yeah.
that kind of stuff. Now, the word cholesterol has come up a couple times while we chatted there. So let's jump to that for a second. Let's talk about cholesterol and HDL, LDL. Good cholesterol, HDL, LDL, by the way, everybody is basically bad cholesterol, if you want to call it that. But the body needs cholesterol. The brain needs it to work. The liver makes it, all this kind of stuff. Talk generically a little bit about cholesterol and because this conversation is going on for, like I said, we could do 2 hours just on cholesterol, but just in layman's terms, what should we be thinking about and aware of when it comes to HDL, which is good, and LDL, which is considered bad?
Well, most people should be screened and have a lipid panel by the age of 40. Your GP should be ordering a lipid panel, or you can be asking for one. If you're genetically predisposed to dyslipidemia, as we call it, if you have higher cholesterol, getting it done a little earlier in life is also not a bad thing. So our HDL is the good cholesterol that we can have that as high as we want. Our LDL is something that we should be flagging as practitioners who are looking at people's lipid panels. Higher than 2 is okay if somebody doesn't have heart disease, but if they have heart disease, anything kind of higher than 2, we want to be working on. So putting patients on appropriate therapies for. The lipid guidelines are huge. So, I mean, I could talk about that for another hour as well. But an LDL that's greater than 3 in the setting of someone over 40, your GP should at least be discussing some lifestyle changes, that sort of thing, if there's things to work on that way. If you have a family history and your triglycerides are high or your LDL is high, then possibly looking at putting you onto a therapy. I know pills are not everyone's favorite thing to talk about, but what we do know is that statins are a drug that actually have won a Nobel Prize. They are one of the drugs that can stabilize coronary plaques. They can kind of prevent people from having coronary events. So it's something to definitely think about or talk about with your GP.
You hit on a couple of things that I want to emphasize to everybody, because again, I'm filtering it through here as a part of just my experience so that you have the education to look out for it yourself. As a male, when you go find a doctor, which I did, so I'm explaining it through my self, Leslie, I bet you this won't shock you at all. You go see a doctor, you sign up to get, are you taking new patients? Yes. You hope them. They ask you all the original questions. Hey, do you have any heart problems or challenge or disease in your family? 99% of guys, nah, I don't know anything. Nah, I don't think so. And then that's it. It's listed on in your file as that, which means that I never had anything on my file to suggest that I should be doing the precursors to checking to see if I have a predisposition or genetics that would make me higher in the LDL category, which I found out subsequent is to be true. Now, that standard test we'll talk about in a second with this lipoprotein A, but we'll talk about that real quick, is that if I would have known that, you see, so the bottom line is this. I started researching my family history a little bit, thinking of mom and dad's side and so on. And of course, it's all there. And that's the point of what I really want to say very quickly to people in general, males specifically, but people in general, is that just because you don't know about what's going on in your family doesn't mean it doesn't happen. So it doesn't mean you have to go and do a genealogy family tree or anything, but you can certainly ask your parents. You can certainly ask cousins and uncles and aunts, and just trying to figure out, I had 4, so if you have 4 uncles that passed away of heart disease, I'm just saying, if your mom passed away of a heart attack, I'm just saying there might be something there. So for example, back to what you said about the LDL, if my cholesterol level, which was basically normal, but I had a predisposition, I needed that cholesterol then to be not normal. I needed the whole life to be really super low, just to offset that predisposition a bit. And I think in hindsight, if I knew that at 40 or 35 or 40, would I've changed? Probably not a lot, because I do pretty well, generally speaking. But I wasn't aware. So does that, did I clarify, does that make sense? What I just said, or is that advice I should not be sharing with my friends?
No, that's completely clear. And I think you alluded to lipoprotein(a), which is in the new dyslipidemia guidelines for Canada, which is an amazing test that we can do.
Talk about that real quick, because I found out my number and I was like, God, I wish I would have known that when I was younger. So that's why I'm telling people now, even if it's not normal practice for your GP, just ask them about it and say, hey, or her, say, hey, can you check that off for me and let's find out.
Yeah, and I mean, it's new. So you know, it might even be you're taking it to the GP and they're saying, oh, let me review the new guidelines. But a lot of the cardiologists that I work with now are saying, yeah, people should be getting a lipoprotein(a) measured. It's a once in a lifetime measurement. But if it's a certain number, so greater than 50, it tells you that you have a much higher propensity towards coronary artery disease. So then you can start looking at someone's LDL level and saying, okay, their lipoprotein(a) was positive as a risk factor for them to develop CAD. So possibly an LDL that would be in a normal range for someone who doesn't have that propensity or maybe family history needs to actually be treated preemptively. So preventative medicine, right?
Right. And so that's, again, the lipoprotein(a) we're talking about. So everyone, just the word, again, I'll put it up right quick there, is lipo and protein. So lipoprotein(a), the bottom line is that's a number that we cannot control, and it's through genetics. Is that true?
That's true. Yes.
And so once you get that number, there's not much you can do about it other than its awareness. It doesn't mean you have anything. You're predisposed to this idea that your blood vessels do a great job of collecting plaque and cholesterol and all those kinds of things. Thus, the point of understanding cholesterol, HDL, LDL, good and bad cholesterol. Is that the right way to kind of approach it?
Yeah.
Because I don't want people going out and asking for a lipoprotein test A and then think, oh, mine is high, I have cardiovascular disease. That's not the answer, right?
Nope, that's not the answer. It just means that you're more predisposed to it genetically. And because you can't influence the level of lipoprotein(a) in your blood, then it's something for your practitioner to then say, okay, we should probably be looking at this person's lipid panel, those sorts of things. They're not really recommending it until you're older. Granted, it doesn't change. So you could have it in your 20s or 30s. It doesn't necessarily have to be something that you get measured after you're 40.
Ah, got it. So now that I have my number, which is above the 50, it's above the 50, what do I do with that information? Well, I'm just saying, if I had nothing happen to me and I had that number, what would you kind of recommend to somebody? I mean, obviously it's not going to panic mode, but it's going to mode. What mode are you going into if you know what that number is? Well,
you're going into just looking at what other lifestyle factors can you influence that can decrease your risk of coronary artery disease down the road. So you want to get a lipid panel done, go through that with your GP, and then looking at your lifestyle. What kind of eating habits do you have? What kind of exercise habits do you have? How do you manage your stress? Are you a smoker? Another thing to get measured would be your hemoglobin A1C, which is your blood sugar, kind of a snapshot over a 3 to 6 month period. If you've got type 2 diabetes, that would be something to be aware of. Diabetes and heart disease are really good buddies. So people with uncontrolled diabetes often will eventually have some sort of vascular issue.
Right.
So thinking about those things, smoking, drug use, alcohol, exercise, things that you can modify yourself, because we can't modify our genetics, but we can modify a lot of other factors.
Bingo. And that's such an important statement there about this idea of genetically, you are predisposed to certain things, and in this case, we're talking about whether you're, the fact that your arteries and your system seems to hold on to cholesterol. It's certainly the bad cholesterol. But of course, we need cholesterol, right? I mean, this is one of the things that I want people to, I know that in my research, I'm nowhere near an expert. Listen, I'm not even a pebble on the beach of understanding any of this, but I do understand now that cholesterol, I mean, the liver makes it, and it's good for your brain in the sense of brain function and so on. So it's not so much that all cholesterol is bad and that conversation is bad, it's just being aware of it, correct?
Yeah, absolutely. And I mean, the more studies that they're doing, it's really the LDL that plays the big role there. Unless we're talking about some other conditions like hypercholesteremia, but those are more familial things. So the LDL, the more they study it, the more they realize we can go very, very, very low. We can go down to what newborn babies have for an LDL in an adult, and it's just preventative.
Awesome.
So, we have some fantastic cardiologists in Canada who are working on all those studies.
You sure do. I know I met a couple. I didn't mean to, by the way, just so you know, I didn't mean to.
Incidentally.
Yeah, it's just part of the show, everybody. Hey, let me just share with you mine right now. And mine is going to be changing or not changing, retested in probably another 3 to 4 weeks. So, I'll tell you off, maybe off air after the show, a little bit more details about it. But my number was, just so you know, basically 6 months ago, my number was, the LDL number was 3.76. Now, 3.5 seems to be the normal, right?
Mm-hmm.
And so I was always below normal until just last year. So I'm, again, the spike in that, you can blame it on all kinds of different things. I'm going to assume that because of the worldwide situation of being less active, not out as much, all that kind of stuff might have played a role. But I certainly wasn't like double or triple. I was just a little bit. So it's gone from 3.7 and it's down to 1.67 now. How's that number?
That's awesome.
Is that a good number?
That's a really good number.
That's what I'm thinking.
That's fantastic.
Yeah, I'm feeling good about that. I'm not going to lie to you. And I'll tell you offline exactly what I've been doing. But generally, there is a role of obviously medication, and there's a role of just awareness. And this is what we're talking about right now, and so on. And let me just jump, Leslie, right now to see. There's so many beautiful comments in here. So Leslie, you know what? I know this is crazy because I was doing so much research about the heart and you specifically and so on. I someone like you is not obviously on LinkedIn and things like that. Or are you? Are you on LinkedIn?
I used to be on LinkedIn, but now I haven't left Alberta Health Services for 20
years.
So I deleted my LinkedIn account. Yeah.
I was just going to say, as I was saying, so some people might want to reach out to you and all that kind of stuff, but she's busy. She's got lots to do. She hasn't got much time to be out there doing social media and so on. So that's why I so appreciate you being here. I appreciate that. I'm just going to go really quickly. Listen, everybody, the comments, I'm going to go through every single one of these in the future. So it's always good. And thank you, Daniel. I appreciate that. It's always good to be back doing what I love to do. I'm just going to see if there's some comments here. There's so many great comments here. Let me just really go through. There's some people. Hey, I just want to do a shout out to Jojo. Just Leslie, and the reason why is that Jojo has her own battle with other things and dealing with, and then now cardiovascular is now entering the picture for her too. So I'm sending her love, I'm sending her positivity, and keep getting all those tests done and all that kind of stuff. It's just fantastic. How is this, Andrea? Good to see you, Andrea. Andrea actually is a person I connected with here on LinkedIn, Leslie, and she has privately shared with me that she is, has some things that she deals with sometimes with her heart. A question, if there's time, how is severe exhaustion and shortness of breath linked to the heart? I know it's a very generic question, but can you kind of address some of that for her?
Well, it would depend if we knew there was any heart problems there. Those could be signs of heart failure, but those can also be symptoms and signs of many other pulmonary conditions that could be causing the shortness of breath. Right. And the exhaustion could be part and parcel from feeling short of breath all the time and maybe not getting enough oxygen to the rest of our body. So it's hard to say if that's linked to the heart or not, if we don't know if there's a heart condition there, but they could be signs and symptoms of heart failure. But like I said, shortness of breath is something that it could be linked to so many different conditions. Yeah.
And this is why, and that's, and I mean, I know that you're not trying to beat around the question, but I mean, everything is so interconnected. And I'll give you what you're talking about when it comes to breathing. I thought I couldn't breathe if you were having a heart event. But I know that my lungs would always fill up with air, no matter how much pain I was in. But I didn't feel like I was getting oxygen, if that makes sense to you.
Yeah.
I was breathing and I was like, wow, I can take deep breaths. So I kept on saying, well, nothing's happening. You're just having an anxiety attack or something. I was just thinking it must be something like that because I can breathe. But anytime there's shortness of breath and so on, that's obviously something to check into. It could be connected to that. But like you said, I know for me, I thought, well, I was breathing, so there's no problems. And that's not the right way to look at it, I'm guessing here. So no, I appreciate that. And like I said, we're not trying to beat around that. It's so hard to find, again, find a relationship between things because everything is connected, and that's the challenge here. Regular heartbeat. Here's a question for you, Leslie. What is irregular heartbeat that causes? What is irregular heartbeat causes? Do you have anything?
Well, irregular heartbeats can be a whole bunch of different arrhythmias. And irregular heartbeat can be caused by many things. For some people, it's actually something that happens to them all the time, and it could just be caused by caffeine or being tired or exercising too much, alcohol, too much alcohol. There's a whole bunch of different reasons for irregular heartbeats, and it would depend on the kind of rhythm that is linked to the irregular heartbeat for how it would be treated and managed.
Yeah. Again, this is so I appreciate that. Yeah. You know, a funny thing, not funny, but I want you to hear this so that it calms some people down. I went for an ECG not too long ago. Look, I got a copy of it. Just so you know, Leslie, I'm learning everything. I'm telling you, like I'm going through it. I'm learning this stuff. I want to know what every beat means.
You're always your best advocate. I always tell patients if they're interested in their health history and wanting to know all the things, you're your best advocate. So keep all your stuff and ask lots of questions.
Bingo. Love that advice. See, that's what I wanted you to. I'm so glad you said that because that's how I feel about it. I'm just trying to be my best.
Just remember, Google can send you down a deep, dark road that you might not want to go down, and it could send you down the wrong path. So it's not a physician. It's not going to see your family doctor or a nurse practitioner and having someone work you up. Right. But keeping track of what's going on with you, what medications you're on, what health events you've had, those sorts of things, always good. I think papers get lost in shuffles, blood work get lost in shuffles. Being your own advocate is definitely a great thing. And I think that people of a younger generation are much more attuned to that than some of my, say, older patients who take a white coat at face value.
Yeah. Hey, great advice.
And that's a bit of a generalization as well.
Of course, we're making general. Again, I'm going to make sure we literally post this today just to make sure the whole point of today. No, we're not giving out advice. We're always going to say, go see somebody physically that you connect with that's in part of your team so that you can, assess your very, very specific situation because everyone's different.
Yeah.
The point of me showing you this is because in my last one, I was almost shocked, but then he calmed me down. He said, yeah, we went through the whole thing, right? And I was going through, and he circled a couple. He goes, there's a little irregular heartbeat there. There's a little PVC there and a PC. And I was like, what? What is that? Like, what do you mean there's a little what?
Right.
So he goes, no. It's very, very normal.
Very normal.
Very common. So explain that so that everyone knows that, if you do have a regular heartbeat, if there's 6 or 7 or 8 in a row on one of these things, not good. But generally that happens to a lot of people, correct?
Yeah, lots of people can have irregular heartbeats here and there. That's not abnormal. We don't jump up and down about those things by any means. But if someone's talking about an irregular heartbeat like atrial fibrillation or some of the more common arrhythmias, those are things that you would want to be definitely getting checked out by a cardiologist and having someone manage that irregular heartbeat because there's risks involved or associated with some irregular heartbeats.
Got it. I want to bring in this, this is a long one, but I know the story behind there. Really beautiful friend of mine, Daniel. Good to see you, Daniel. I hope you're healing well and so on. Daniel was in the hospital recently with COVID and pneumonia. So, and he has oxygen at home, so he does take oxygen when he needs it and so on. But he's made a few posts about the idea of his heart racing, his heart actually going up. Now, another friend of mine here, strangely enough, and I hope she's okay in me mentioning this, but Melody wrote an article recently about her experience with SVT. So I'm learning. Yeah. You see, I'm going down
another arrhythmia. Yes.
Yes, I'm going down that. So I just wanted to mention this. He goes, I do feel gentle pain in my chest, but it feels like it's just congestion. Going to talk to the doctor in the next few days. So this idea of having pneumonia and or COVID, people who in the world now are more and more ever recovering from it,
right,
may feel have issues, either a racing heart or breathing issues and so on. Just talk generally what we should be doing. Obviously, we're going to our doctor, but it doesn't necessarily mean it's related to the heart, correct?
It might not be. No, that could be that chest pressure pain could be from coughing so much with COVID pneumonia,
right?
That you've actually got some strain there. those sorts of things, musculoskeletal. But that being said, I would definitely go and get checked out, especially with having had COVID and pneumonia.
Yeah. And, anytime your heart races like that, again, I think he even posted this. That's why I don't feel it's unusual to mention it, is that, as high as, just sitting down, basically up as high as 110 or something. Uh-oh. See?
It's all good.
It's all good. Okay,
It's
good.
all
I don't
good,
want to
yeah.
decode whatever colors you're working on.
No.
I don't want to be inspired, because I know I was one of those. I was one of those calls. So I don't want you to be sitting here talking to us right now. But listen, I want to talk about, now that we're just talking about the LDL and all that kind of stuff. And let's just talk about this. A lot of people, because I've never owned one before, I went out and actually purchased. Now I have a blood pressure machine. So
Yeah.
I'm tracking this stuff. And I think a lot of people actually do that more than actually admit it. But generally speaking, blood pressure, what should we know about blood pressure in general terms? I know there's a benchmark for it, but it can fluctuate. And just talk about, generally speaking, what we should be looking for if we're tracking that kind of thing.
Well, ideally, we like to say that we want it to be 120 on 80. So 120 is your systolic, your higher number, and your diastolic on 80 or 70 even. We have hypertension guidelines that are public. You can look them up online.
Yes.
That being said, what I usually tell patients when they're leaving the hospital is buy a blood pressure cuff if they want one, with the Heart and Stroke Foundation stamp on it. That's always a good tip. And then to measure it and write it down. But remember that we're looking at trends. We're not always just looking at absolute one-time numbers. What we want to look at is the trend of it. Also, for patients with heart disease, we want to look at, what's your morning blood pressure before you take your medications? What's your evening blood pressure? Just because that can also help your GP, nurse practitioner, cardiologist titrate your medications to keep your blood pressure in a good range 24 hours a day. So those are things to write down, and remember that it's a trend. Isolated numbers themselves, write them down, but they're not always lights and sirens, right? You may have just run up the stairs with a load of laundry and then decided you were going to take your blood pressure.
Right. I know. I've been trying to do it what I've noticed, though, because I think this is really important. It leads to another question, but let me just share with you very quickly, see what you think. Here's my, I did one this morning. So it was at 6:37. At 6:37, mine was, and I don't like I like the 80 to be under 80. I don't know why I'm getting into really.
That's okay. 70 is a great number too.
I know. That's what I'm thinking. I want that one. But it was 118 over 80 and the pulse was 55.
Yeah.
How am I doing?
That's fine.
Right?
Yeah. You're A-okay.
A-okay? Yeah.
Yes.
So, and I'm looking at the average. If I was looking at my statistics in general, and I'm trying to track this stuff on an average. Let me just go back to the average here. The overall average over the last 2 weeks is 121 over 78. So that's kind of Texas, isn't it?
Yeah.
Now, with me saying that to you, I just want to share something with you. But it was like that before. Do you know what I'm saying? So that number then, so every time they used to wake me up every hour, by the way, which I appreciate it, you guys did that. But every hour you woke me up to take my blood pressure, and after a while you get cranky.
Yes.
And at 4 in the morning, you're waking me up to take a number that apparently didn't matter to me before this event. You see the cynicism? What I'm getting at is that it's like, well,
absolutely,
the blood pressure wasn't high before, so now you're telling me I should feel good because it's low now. So just address that about the concern.
Well, and you don't have hypertension, so you don't have high blood pressure. That wasn't one of your contributing factors to your coronary artery disease event, to your heart attack. I know you don't like that word or that phrase.
I'm ignoring you. It's okay.
But hypertension, high blood pressure can lead to coronary events and can lead to heart disease. So it is something for people to be aware of. And it's also something that's genetic. It isn't always necessarily genetic. It can also be brought on by other factors. But, it's something that we look at with patients. And in the hospital, yes, we do measure all of those numbers ad nauseum, I'm sure, for patients, but
well,
everybody, it makes everyone feel, we need to make sure that we've got you all shined up before we let you go home.
That's true.
And blood pressure is one of the things we want to be shiny. So
okay. I'd be crazy if I didn't mention this. I'd be just so silly, because I know that stress, anxiety, and so on is it just, I mean, let's face it, in the last 24 months for most people, it's their lifestyles, everything has changed. Work, work from home, the kids not going to school, all the factors. We all know what they are, everybody, but stress, anxiety, these kinds of things, and lack of sleep. By the way, insomnia was another one of the things that, Leslie, I always had. I've never been a good sleeper. I've never woken up rested in my life. I've never, maybe I can think of 10 times in my life. I just don't, people get up in the morning and go, oh, I feel super rested. I'm like, I don't know what that feels like. I really don't. So I know that factor, but stress, talk to a little bit about stress, because that's right up there with all of the top contributors to heart disease, correct?
Right. So there isn't really a lot of studies that can correlate exactly heart disease and stress together, but the way that we manage our stress can definitely be correlated with heart disease, in that, you know, people overeat, maybe don't sleep as well, don't exercise, smoke, use alcohol, use different kinds of crutches that way to manage stress. Stress over a long period of time, or chronic stress, can lead to inflammation. We do know that inflammation can lead to vascular problems. So there's those sorts of things can all play off of each other, certainly.
Yeah, I'm just sharing openly with people, and I've talked about this. I think sometimes we think stress is something that you can kind of see anyway. It's just kind of like what we're talking about with coronary heart disease, is that it's stress it's different for everybody. It's and the levels of it, mine is not worse than yours, and all of these factors combined. So, but it does play a significant role personally, and I'm saying this to anybody who's, you know, especially over the last 2 years of their lives, you know, with life changes and so on that's happened because of the pandemic, is that I know it played a role for me. I just know it did. I don't know to what degree. So when I add my genetics together with stress load, right away there I am. And then, you know, again, the predisposition, the genetics, you're already kind of in a situation where, wow, you have to just be aware of it. So this is why, again, you know, sometimes mental health and awareness and these kinds of things, I think we sometimes have the conversation of we're just trying to settle someone down in their mind and so on, but you can be saving someone's life when you're trying to talk to them about stress and help them manage their stress and so on. So I'm gonna assume that this is not going to change for you, because I know that with your beeper going off, it's not getting slower over there. I went over there and I saw so many people of all ages, by the way.
Yeah.
Would you be able to even suggest that is going to play out over the next few years? I'm going to guess it is, right? I'm going to guess it is.
Yeah, I don't think anyone really knows what we're in store for after the pandemic is over, but I do think that we've probably adopted some lifestyle habits that may affect people maybe earlier than they would have presented before. Or it's hard to predict.
It is hard to predict.
Or people scared to come into hospitals. That was a big thing that we've been trying to put out to the media, and come in. It's not full of COVID. If you're having a heart attack, don't stay at home. You know, those sorts of things. People coming in with late presentations because they don't want to go to the hospital because they're worried about COVID.
Yes.
And then, you know, having heart failure due to that. So
listen, I'm going to tell you again, sharing this just between you and I and whoever wants to listen right now. When I was having all kinds of different situations where at least 10 times I could have dialed 911. Literally, that's what I said to myself. I wasn't scared of COVID and stuff. You know what I'm scared of, or I didn't want to do? I didn't want to stress out our healthcare system. I didn't. Right. I really said to myself, Peter, come on. There's people down there really, really sick, man. You don't have to do that. Settle down. All I was saying, settle down. That's what I was saying in my mind. Settle down. You don't need to go. You're not going to go down to emergency and tie up the system. Don't be so silly. Right. And all I'm saying is that you know your body. I knew my body, and I should have not listened to that other brain. I really should have.
Right. The denial brain. It's easy to go into denial.
Right. And I just think it's amplified now because of our situation with our healthcare system around the world. So all I'm saying to people is, you know your body. If don't not go. In other words, don't make the decision not to go because you think you're stressing out the system. You know your body, and so that's one of the things.
And we're lucky to live in a country where you can go.
Absolutely.
You know, and you can walk right in, and everybody gets treated the same.
There you go. Look at this, Jim Poirier.
It's my husband.
There you go. Hey, Jim. Rock star right there. Hello, rock star right there. I agree with you, buddy. I agree with you. I think that's fantastic. I really do. Listen, we got so many great comments in here. I'm going to try. Let me just see if I can get one more question in for you. And then what we'll do is, okay, I had LDL levels as 3 years. Wow, Boston Paul. I had LDL levels as high as 224.
That's American. Okay.
Okay, so yeah,
I can roll with this number. Yeah.
Okay, I was gonna say I don't know what you meant. I was like 224.
Whoa.
Like, yeah, I didn't understand that. So, very bad family history, monitored medical treatment, and daily dose of 𝗟𝗶𝘁𝗵. You know.
So Lipitor or 𝗟𝗶𝘁𝗵, and then we have Crestor, also called rosuvastatin, which I think you're on the latter.
Keep going. So this is detection and key is understanding. So no, I think his point here is that the statin is basically what we're referring to.
Pharmaceuticals are not always bad. I know that lots of people don't want to take them, but like I said, statins, I mean, we know so much about so many medications that are very helpful.
Right.
And can stave off other bad things happening down the road, right? Prevention is key. And I agree, detection and talking to whoever your healthcare practitioner is.
Yeah, there you go. So I agree with you so 100%. Your own health advocate. There you go. You talked about this, but Melody, good to see you, and I hope everything is working out. Melody is the lady that I referred to, the beautiful lady, who has SVT. And so I'm gonna is that I say that? Yeah, SVT. I don't know how to say the big word, but I know I'm working on it. But be your own advocate. And your doctors are your partners in this. And I know that that's something that I know that you advocate for that. I know that that's part of your messaging as well. And I do want to throw this one up here. This is a pretty interesting one. Farrell, good to see you, my fine friend. Good to see you. Appears changes thinking around normal and high. And that we were just talking about blood pressure. And this is why I'm going to revisit that, only because I know that when mine moves like even a few numbers, I'm like, what's going on? Why is that happening? And it's not, don't be just scared from it. I have to learn from that. But basically the average being 130 over 88 or 90-ish, let's say, considered to be the normal range, and he's 6'3". Does that sound about right to you? Because if I was at 130 and 90, I'm just being honest, I'd be a little scared. And I don't think you should be scared, because that's the point here. Is like the number is different for everybody. True?
Yes, that for sure. There's also a range of what normal is. And then we also take those numbers in context of all the other things that are going on with a person, right? Like I said, it's not an isolated thing. You look at it, what their other health factors are as well. So
yeah. So no, I think that's a great point, Farrell. Is that again, it's going to be different standards, maybe, and different. And again, the number's not too far away. And don't get me wrong, when I had mine, when anytime it goes up into 130s or anything like that, that's different for me. So that's why I was saying that triggers me. It was no different than when my pulse rate. I woke up one morning, Leslie, and it was like 49. And I was like, what is going on? Like I thought that was super low. If you tell me anytime you got to go. Okay. Let's you still got a few more minutes for me? You still got a few?
I probably got a minute or two.
Oh, a minute or two.
On that pager. Yeah.
Oh my. Okay, we got to get you going. Okay, so stay with me here. I'm going to blow through these so quick. But listen, we normally have something on here called basically this or that, and sometimes I do way no way. But we're going to do way no way with Leslie, and it's going to be the heart version of it. Here we go. We're going to be ready for that. Here we go. Okay, for some reason that didn't even play, so I don't know what happened there. That didn't play. Here we go. Let's do way no way. Here we're gonna go way no way. You ready for this? It's the hard edition, way no way, and I'm gonna say a sentence, and you just kind of say way or no way. Way, yes, definitely. No way, and just a one-liner behind it. You got to go. Here we go. Real quick. If you take a cholesterol-lowering drug, you can eat anything.
No way.
No way.
In moderation, though.
Everything.
I don't like people to not live their best life, right? I mean, sometimes you want to have the treat.
Okay, got it. Okay, there you go. Beautiful. Here we go. Heart disease is an old man's disease.
No way.
No, affects everybody, right? I mean, we're talking about here. Okay, here we go. If you have a diet high in salt, it's likely that you have an increased risk of suffering from heart disease or stroke.
That's like a way, no way question. It depends there's genetics. Some people can eat a high salt diet and be fine their whole lives. But yes, you are increasing your risk. Certainly, if you ate fast food every day for your whole life, you're increasing your risk of having something vascular.
Okay, got it. Yeah, that makes a lot of sense. And again, that's why some of these could be in the middle, so you feel free to do that. Absolutely. This is going to be touchy, but let's care about this one. Vitamins and supplements can be used to decrease your risk of heart disease.
I would say no way. No, I think you need to go and talk to your GP, your nurse practitioner, about what you think you're taking, because there's things like omega-3, which we now know doesn't help at all. But they'll tell you at the nutrition store that it'll help. So there's lots of studies and things. So definitely, I would take some of the promises with a grain of salt.
Do your research. Do your research. That's what we're getting at, right? That's what we're doing. It's okay to have high blood pressure when you're older. It's just part of getting older.
Your blood pressure could raise as you get older, certainly. And we have different numbers that we're happy with for different age groups, certainly.
Yeah. So is it okay to have high blood pressure?
It would depend. Like I said, it's always the one number that you're correlating with all the other things that are going on.
Okay, fair enough. No, that's good. If you don't sleep enough, you may have a higher risk for cardiovascular disease, no matter your age or other health habits.
Well, they have been doing studies that are correlating sleep habits and time of bed and those sorts of things with an increased risk of coronary artery disease. So way. There you go.
Yeah. We need some ways and no ways. This one, I'm so super want to know this, because I've been advocating this, and I hope I'm right. A daily dose of baby aspirin, like 81 milligrams therapy, may be recommended for the primary prevention of heart attack or stroke. I know it helps with the second one, but what about pre?
No way. No, we're really starting to move away from that in the medical community, not recommending that. It used to be more of a blanket strategy that you tell everyone to take low dose aspirin, but they're finding that maybe it isn't as helpful as we once upon a time thought.
Okay, we haven't got time to dig into that. Okay, I might have to take that back from a few friends I told.
Well, but they could go and talk with their GP about it, right? And see what kind of context they're using the low aspirin.
Got it. Okay, beautiful. Yeah. Okay, we're almost done. I know you have to go, so I no one's waiting on you like I was. Drinking too much alcohol mostly affects your liver and won't hurt your heart.
No way.
No way.
No, drinking alcohol can affect your heart, certainly.
Okay, really, really important. For the women, this is so important. The women in our lives, once women go through menopause and their hormones shift, their risk of heart disease increases.
Way.
Wow.
Yeah. Women are protected by hormones to an extent, which is why women get heart disease later in life, but it's still right up there for one of the top killers of women.
Wow. See, and that's why, again, it's so important to talk about this. It's not a male, it's an old man's disease. It's not a male perspective. I'm doing it because I'm from my perspective, but that's it. Now, this is the most important question before you go. Very, very important. So really pay attention to this question. Okay. This is the big one. This is the big one. It's better for a person and their heart to go and play rec hockey this Friday afternoon after 7 weeks after their heart event than to sit home and feel sad and depressed.
I would say you should go play rec hockey.
Yeah. Really? Can I do that?
Take it easy. I mean, don't go out guns a-blazing.
No.
But go skate. Enjoy yourself.
Yeah, that's what I'm thinking, right? And I'm a goalie, so no one really hits me, and they shoot pucks at me. So I notice I've been bruising a lot more.
You will, certainly.
So I'm thinking if a puck hits me, I'm going to get bruised. But can I show this clip to my spouse?
Sure.
Appreciate that. Okay, that is awesome. I cannot tell you how much I super appreciate you being here. I really mean that. I know you have to go, and this is why I'm going to rush through this real quick. But thank you so much. Thank you.
Thanks for having me. That was a lot of fun.
I just so appreciate what you've done for me, and the many people that you touch in your life, and your husband, obviously, and your mom, and people should be so proud of you. I'm proud of you, because if you weren't part of that team, I don't know where I'd be. So
thanks, Peter.
I so appreciate it. And I hope, hey, maybe we can do this again another time. And so we'll, again, the whole purpose here today, everybody, just to make sure, and I want to make sure everyone knows this, it was all about just inspiring everyone. There was no medical. The whole point of it here was for Leslie to share her experience. She was on the team that helped me. And I super appreciate that. So thank you so much, Leslie. It's good to see you. And you know what I'm going to do? I'm hoping my dad's watching this show. My dad never watches my shows because I never told him I have a show. Did you know that, Leslie? I've been doing this. He was like, I know he's probably thinking, I didn't even know he did that. I know. I know. That's what I'm thinking. So today was all about heart, all about family. I'm going to play out a video at the end. Leslie, you get going. You got to do your thing. And as I end every show, but just so you know, everybody, because it makes a lot of sense to me. It just makes a lot of sense to me. You know what? Just be kind out there. Just be kind out there. That's all we can do. Is just be kind out there. So take care of yourself, everybody. And we're going to end off on this video with my dad. And so I hope. Oh, she's got to go.
I do. Okay.
Talk to you soon. Bye.
Take care. Thanks for having me.
Thank you.
Bye.
Hi, I'm Peter Clark in beautiful Peggy's Cove, Nova Scotia. You're watching Red TV.
I'm the real Peter Clark. I'm here in Peggy's Cove, and I'm watching Red TV. Let's go.
That was good.